Now, each day, approximately 5 South African men lose their lives to prostate cancer. Detecting this disease early significantly boosts survival odds to around 95%. And nowadays, a prostate exam can be minimally or even non-invasive, but a lack of preventable health care is a global trend amongst men. Let's find out more now from Oberholzer, who is the CEO of the Prostate Cancer Foundation, who joins us in the studio. Andrew, thank you so much for your time this morning. Why don't men want to go for their once-a-year checkup? What is this mental blockage that stops them just from doing this one simple thing to keep them safe?
I think men generally with checkups are just not as good as women. And then traditionally, the prostate cancer screening has involved both a digital rectal examination, that's the finger up the rectum, which is a scary thought for men. But nowadays, the PSA blood test is sufficient as a screening tool. So it's just a simple blood test. So let's take the fear out of it, guys. Even though the actual finger or the digital rectal was only 20 seconds, it did put a lot of men off. And I think just men need to take more ownership of their health. They tend to wait till things break, which is never a good idea, because with most cancers, and particularly prostate cancer, early detection is really the key to survival and the best treatment outcomes.
And when you talk to men, especially men of a certain age, from about 35, 40 upwards, what is the feedback you're getting from them as to why they didn't go and have themselves checked out earlier?
So many men just are not aware of the importance of prostate cancer screening and how common. So prostate cancer is the most common cancer in men, and in fact by 2030 will be the most common cancer in South Africa. So it's, first of all, they don't know what age they should be testing from, and it's age 40 for all black African men and anyone with a history of prostate or breast cancer in a first degree relative, and age 45 for everybody else. And the reason that we encourage black guys to go to a slightly younger age is that they are at 60% more at risk for prostate cancer and 2.45 times more likely to die from the disease. That's why we want to really try and catch that cancer in the early stages when the treatments are curative.
And what is your research telling you? What impact does lifestyle and nutrition have on your possibility of being able to avoid this beast?
So we're not quite sure what causes prostate cancer. It's a little bit of a problem. There is a strong genetic link, and that's why if you have a mother or father who've had breast cancer or prostate cancer, it's important to go for screening. But we encourage men to lead a healthy lifestyle anyway. The only actual modifiable risk factor we've identified is the number of ejaculations a man has a month. More than 21 seems to reduce the risk slightly, and that's a pretty easy health behavior to change. But
I feel like whoever's marketing towards men for prostate exam checkups are missing a beat there by not putting that as their main selling point. Now we're talking about trying to get people to go for those checkups. What are you hearing in terms of what kind of treatment people are receiving when they're going for those checkups? Is there still a stigma involved when the man turns up at just an ordinary government clinic and says, this is what I've come for? Is there any work that's needed in that regard?
There is a lot of work. We need to educate primary healthcare workers about prostate cancer and the importance of screening. So they'll generally only screen if men are symptomatic, and we don't want to wait until men are experiencing symptoms. The biggest challenge with prostate cancer is that there are no symptoms in the early stages when treatments are able to cure the disease. So that's why screening is so important. So we need education, we need to increase access. We're trying to work with government to implement prostate cancer guidelines to make sure that screening can be done at that primary healthcare level, because that's where we're going to be able to detect the disease in the early stages and actually treat it and cure men. Once prostate cancer spreads, we can't cure it.
Sure. And cancer is not the only health issue with regards to prostate. So generally having a healthy prostate is a good thing, even if you are avoiding the big C.
Absolutely. So an enlarged prostate, a condition we call benign prostatic hyperplasia, is also very common in elderly men. It's very frustrating because it causes these what we call urinary symptoms. So men have to get up at night and go to the toilet a lot. They go to the toilet and they can't urinate properly.
Yeah, we all have those uncles in the family.
Exactly. So those can be frustrating, but they're treatable. And the man's go-to doctor is what we call a urologist. They are specialists who deal with our male reproductive parts. They also deal with the urinary systems of both sexes, and they are able to treat these diseases. The treatments have improved continually. For early stage prostate cancer, we have robotic surgery, we have radiation treatments available. So the treatments are improving all the time, and the issue is for men to go and get those checkups, not be shy to see a healthcare professional, take ownership of your health.
Absolutely. Now, just as we complete this conversation, you're wearing your sticker, Suit Up September. Tell us about that campaign.
So September is Prostate Cancer Awareness Month. We as Prostate Cancer Foundation encourage people just to suit up on any day in September. Just buy one of our little stickers for 50 Rand. Women can get involved as well. They have an important role to play. And then in October, we take our clothes off and we do the Whole Daredevil Run, which is a fun, a great fun event. And that is happening on the 13th of October this year. You don't have to be in Johannesburg. It's now, you can participate anywhere in the country, get a group of guys together, get your Speedos from Daredevil, that's 180 Rand, and it includes your Speedo. Get a group of guys together. We encourage boys to get together as well, because it's good to teach boys from when they're young to take care of their health, and they are at risk for testicular cancer.
Just one final question before I let you go. You mentioned the role of the woman in the household, and that, of course, is if you're talking about a traditional household. One would believe that the partner of a man that needs to be checked out is quite key to encourage them to take care of themselves better and go and get that all-important checkup.
Very much so. The women are the gatekeepers of our health in families, and they are pretty responsible with going for theirs. So we thank the women who encourage their partners to go. Please keep doing it. Push those men to go get their health checkups. Okay, well, there's your message for this morning. Go and do it this morning as well before you go about the rest of your weekend. Thank you so much for your time and for coming in for that. That's Andrew Oberholzer, is the CEO of the Prostate Cancer Foundation.